While today's focus was on the healthcare mandate, Obamacare also includes major changes to the way doctors and healthcare providers do business. Physicians and hospitals across the country are scrambling to keep up with the new law. Joining me now, Dr. Sreedhar Potarazu, the CEO of Vital Springs Technology, and I will call you Dr. P through this entire interview. Listen, we were talking in the break, and I thought this was so interesting because now we seem to have really big questions about the individual mandate and whether it can stand or not. You say if it goes and the rest of Obamacare stays in place, it's a nightmare for insurers. How so?
Absolutely, because the insurers were banking on the mandate to help them cover the costs for all the people they had to take in with pre-existing conditions and the younger people who now were able to join their parents' policies. They are clamoring at the bit right now, and I'm sure the CEOs of many of these insurance companies today are very nervous on what happened this morning, because if the mandate falls through, then they have to eat the cost of taking on all of these people, and it becomes unsustainable. So it's chaos if that happens. It's chaos
if this happens.
Absolutely.
Well, you know what's interesting is that the industry is already changing dramatically in front of this. There's a lot of consolidation going on. Is this a good thing or a bad thing?
Well, the consolidation has raised prices, Jerry, and you know this because in anticipation of them having to take people on, hospitals and insurance companies started gobbling up physicians' practices.
Right.
It's gotten really hard for private practitioners to actually stay in business because if they don't succumb to the hospitals buying them up, then they've got to compete with this monopoly in the community.
Well, you know, you would think this would have been good for doctors, but you're saying if you're just a primary care physician, somebody with a general practice out there, you're really under the gun. You can't make it on your own.
It's terrible. They've had to foot the bill to go and implement electronic medical records. They now have to consolidate and get paid less and go into the administrative hassles to be managed by an insurance company. They have to see more patients, and reimbursements are going down. There's nothing good that has happened with doctors in the last couple of years.
From the patient point of view, too, you know, we were promised that our costs for health care would go down. In fact, they've gone up. You look at the cost for a family, insurance premiums were supposed to come down $2,500 a year. They're going up $2,200. I mean, this makes no sense to me because the original thought of Obamacare, health care reform, was supposed to be about bringing costs down, and in fact the opposite has happened.
That's right. It was about keeping your doctor, keeping your plan. Very few people can actually keep their doctor because insurance companies have shrunk the networks. Right. The other thing is about keeping your plan. Well, as you said earlier in the show, a lot of employers are thinking about dropping coverage and telling people to go out and maybe get insurance from the insurance exchanges. The insurance exchanges don't even exist. They've just rolled out the plan a month ago for insurance exchanges that have to be up in probably a little over a year. That's scary.
It is scary stuff. You know, we had a plan in place, and it was a plan that was sponsored by employers. There were no taxpayer dollars that had to go to it. This was entirely sponsored by people employing other people. It seemed to work pretty well. It didn't cover everybody, but it was a cost that was not borne by taxpayers. Now that program falling by the wayside, 30% of companies likely to drop coverage. Is this any way to operate healthcare in our country?
It's not. And if you look at the key issues that came up this morning, Jerry, about the mandate, you're forcing people to buy something, a value that they really don't even perceive or may not even exist. So I was just saying earlier to somebody that suppose I told everybody that everybody has to have a car. It doesn't matter whether the car works or not, whether it's a used car or a new car, you just have to have a car. Essentially what they're doing is saying that everybody's got to have an insurance policy.
That's right.
And simply having a policy is not synonymous with having a policy that actually can cover the things when you need it. And so if we're forcing people to pay something for which there may not even be real value.
We don't know what the value might be at the end of the day. That's really interesting. You know, we're going to be watching the severability issue tomorrow, and it's the thing we started this interview with, the idea of what happens if the mandate gets thrown out. What should we be watching for in those arguments? Is there anything in your mind that you're thinking, boy, if they address this issue, this will be important?
Well, I think today was key because, as I said earlier, the mandate goes hand in hand with everything else in the law. Because if the mandate goes over here, then across the street, the CBO is going to be shot because all of the estimates in terms of how this bill is based on the mandate. So it's back to the drawing board because, look, we're already, the credit rating for the country is down. We're in an enormous deficit. The mandate was really the crux of helping to pay for the bill. And if that is nullified, then we've got a major problem, not just in terms of constitutionality, but more in the economic impact to how we actually paid for this elephant in the first place.
Well, I was thinking you might come on with good news, but
I wish I could.
All right. Thanks so much for coming on,
Thanks for
Doctor.
having
Really
me on.
appreciate it.
Thank you.